Hi guys, this is Dr. Cedeno from Houston Dermatology and Plastic Surgery. Today I'd like to talk to you about skincare regimens. Skincare regimens can be as easy or complicated as you want them to be. But there are certain products and certain things that we as dermatologists recommend as just basic. And I want to start by the most basic is washing your skin. We recommend that you do it once to twice a day. We don't recommend that you do it more than twice a day because that can dry out your skin significantly. Depending on your skin type, we can recommend something more hydrating or more astringent. And there are multiple great brand names out there that can accomplish these goals. So typically dermatologists recommend either CeraVe, Cetaphil, Aveeno, Neutrogena, Vanicream if you're very allergic. So these are brands that are commercially available and that carry excellent cleansers. For oily skin, we recommend products that have 2% salicylic acid or benzoyl peroxide at different concentrations. Over the counter, we find between 2.5 and 10% benzoyl peroxide cleansers that are really good. There are other cleansers with sulfur or glycolic acid that can be used for very oily skin. If you need hydration, you need something with ceramides, for instance, with hyaluronic acid that can hydrate your skin. So now that you've washed your skin, many people like using a toner. And for toner, nowadays it's very common that people use tea tree oil or glycolic acid. So these are good astringent toners, but I don't recommend that you use them on a daily basis, maybe once to twice per week. Moisturizer. Moisturizer comes in different flavors. Serum, that's lightweight. Lotion, a little bit thicker. Then cream, then ointment. For oily skin, we recommend serums and lotions. For drier skin, we recommend creams or ointments. And you can do as many times as you want, depending on your needs. After that comes moisturizer, and this is the order that you're going to use. Washing your face, moisturizing, then your sunscreen. And many people ask me if the sunscreen that's built in the moisturizer would be enough. The answer is depending on your needs, okay? If you're gonna be outside and you're gonna be spending a lot of time in the sun, you need to use mineral-based sunscreen. That's the best. Why? Because it offers you a physical mineral barrier that's going to protect your skin, not just from ultraviolet light, but also from visible light, which can also aggravate problems like melasma. So back in the day, we had multiple chemical sunscreens. We've now migrated away from chemical sunscreens, and we prefer to recommend mineral sunscreen with zinc oxide or titanium dioxide. For the next step, women mostly is makeup. And for makeup, again, I recommend the mineral makeup over the chemical makeup, but that's based on how you tolerate it, based on your preference and your budget. That's for the morning regime. At night, I recommend that you wash again your face, and then the use of retinoids. So retinoids come in different flavors and strengths. Commercially available ones, there are pretty good ones, okay? Nowadays, adapalene, the branded product is called Different, is over the counter, and you can use it a few times per week in a gel formulation to minimize oiliness, some fine lines, pore size. You have to use it at night, especially the Retin A version of the retinols, because they get deactivated with sunlight. So that piece of information is critical sunscreen, and a good retinol will make your skin age more gracefully. If you want a more sophisticated type of regimen, the use of alpha hydroxy acids, like glycolic acid, the use of beta hydroxy acids, lactic acid, salicylic acid, the use of antioxidants like vitamin C or ferulic acid, resveratrol, those are a little bit more complicated regimens. My proposal is that you keep it simple. But if you would like to discuss a more tailored, individualized regimen, please give me a call or engage with us via social media. Have a nice day.